Now, whenever we have these patients of epileptic seizures, we must know what are the special issues that we're going to cater to in these particular patients. Over here, we're going to consider the fact that we can have the catamenial epilepsy. So it's again very important that you focus on the fact what is the how is the particular onset of epilepsy in the patient, and you're going to manage the patients even accordingly in this particular case. Then pregnancy is also sometimes associated with the epileptic seizures. Either it is a newly developed epilepsy in the states of pregnancy, or either it can be the already diagnosed cases of epilepsy, and after they get pregnant, you're going to alter the doses of the drugs that you're giving to the patient. So this is again very important, and you're going to specifically design the manage the patients accordingly in this particular case. Then contraception. You also can resort to this particular contraceptive techniques that you can resort to in the particular patients, and they have their own benefits. Obviously, you're going to weigh the risk versus the benefit ratio in the particular individuals, and that is going to highlight a lot of factors. Breastfeeding is one of the states. The drugs that you're going to prescribe to the patients, they have to be very safe for the baby as well, and you're going to consider these facts when you're prescribing the patients with these particular drugs.